knocking on the door, providing privacy, washing my hands. Hi, my name is Michelle. I am a nurse with Presentation College, and I'm going to do your head-to-toe assessment today. How are you?
Good.
Good. I'm just going to check your wrist here. Can you verify your name and date of birth?
Anna Rivero, January 1st, 2000.
Perfect. And Anna, do you have any allergies?
No.
No? Okay, perfect. What I'm going to do is I'm going to assess everything from the top of your head to the bottom of your feet. I'm looking for any abnormalities, any bruising or lacerations, any bulging. I'm going to be checking your muscle tone and strength, skin turgor, skin temperature. If there's any pain or tenderness noted during the exam, go ahead and let me know. I'm going to start by doing an eye exam. I'm going to have you hold that over one of your eyes, and holding this 14 inches away from your eyes, I want you to read for me the smallest line of print that you're able to see.
4, 2, 8, 7, 3, 9.
Okay, and your other eye?
4, 2, 8, 7, 3, 9.
Perfect. Patient has 20/20 vision bilaterally. I am going to start over here. We will start with your skull. I'm just going to feel the patient has nice thick brown hair. There's no balding or patches noted. The patient appears to have good hygiene. She's dressed appropriately for the exam. She's alert and oriented ×4. Her mood is pleasant. She doesn't appear to have any problems with hearing or her speech. She's answering my questions appropriately. There's no flaking or dryness. The hair is not dry or brittle. When feeling the scalp, there's no bulging or depressions noted. Is there any pain or tenderness?
No.
Okay, perfect. Then I'm going to have you turn around here. I'm just going to feel your temporal artery. Any pain or tenderness there?
No.
Okay. The temporal artery is elastic and non-tender, which are normal findings. I'm going to palpate the temporal mandibular joints. Can you open for me? And then close, open, close. Are you able to go side to side? Perfect. There's no popping or clicking noted. When I palpate your ears, is there any pain or tenderness there?
No.
Okay, perfect. I am going to check your cranial light reflex by putting the light on the bridge of the nose. The light is seen equal and bilaterally in both pupils, and both have brisk constriction, so pupils are equal and reactive to light and accommodation. The eyebrows are nice and thick. Her eyelashes are evenly spaced. There's the skin is warm and dry. There's no cracking or lesions. The conjunctiva is pink and moist. Her sclera is white and glossy. The iris is brown in color throughout. I'm going to have you hold this over one of your eyes, and then tell me when you can see my fingers in your visual field. Okay, and then your other eye. Perfect. And then watching the pen light. Can you let him outside, somebody, please? I want you to watch the light, follow it with your eyes, but not with your head, okay?
Sensor 3, gunning room open.
Perfect. There's no nystagmus noted. Let's see. Next, I'm going to look into your ears by pulling the pinna up and back. I'm gonna look.
Center 3, dining room, open.
There is a small amount of cerumen present. The tympanic membrane is pearly gray. There's no discharge or bulging, no redness noted. And then in the right ear, we'll do the same. Small amount of cerumen present. The tympanic membrane appears normal. There's no foreign objects. It is pearly gray, translucent, and there's no discharge in that as well. Let's see. I'm just going to palpate your sinuses. We've got your frontal sinuses and your maxillary sinuses. Is there any pain or tenderness in those? Perfect. How about when I press on your nose here? Okay, good. I'm just going to look. Are you able to plug one of your ears and sniff? And then do it to the other. Perfect. So both nostrils are patent. There's deep pink mucosa. In each, no foreign objects are present. The septum is midline, turbinates are visible. There's no deviation. Everything is midline and appears normal. I'm going to have you close your eyes and I'm going to check the cranial nerve 1. Can you tell me what you're smelling?
Coffee.
Perfect. So cranial nerve 1 is intact by the patient telling me what she smells. Alright, if you can look at me again, I'm going to have you open up and say ah. Alright, stick your tongue out. The uvula is midline and protrudes upwards. The tonsils are visible, about a +1. Teeth are evenly spaced. A couple caries on the molars are noted. The tongue has a thin white coating, which is normal. The gums are pink. There's no bruising or lacerations on her gums. She has nice white teeth. Everything looks aligned well. I'm just going to check your facial symmetry. Can you smile for me? Can you puff out your cheeks? Can you raise your eyebrows and squint your eyes? Perfect. Next, I am going to palpate your carotid artery. And on this side. Perfect. I'm going to listen here for any bruise. Can you hold your breath? Okay, and this side. Perfect. No bruise are present. I'm going to palpate your trachea, which is midline and symmetrical. I am going to palpate for the thyroid gland, so I'm going to just move your trachea over and then have you swallow. Go ahead and swallow. Okay, the thyroid gland is not palpable, which is normal findings, indicating absence of inflammation or infection. Can you kind of tip your head back just a little bit? I'm going to check your jugular vein. I note pulsations, but there's no distension in the jugular vein. Go back just a little bit. There we go. And the same on this side, no distension, but mild pulsations are visible. Let's see, let's do the hearing test first. I am going to hit the tuning fork and then place it on the top of your head, and I want to know where you can hear the vibrations. Just let me know if it's in one ear or the other or both, and then let me know when you stop feeling the vibration.
Both.
Both ears?
Stop.
Okay. And then now on each ear, I'm going to hit the tuning fork, and then I want you to let me know when you can no longer hear the vibration, and then I'll do it in front of your ear as well, okay? Stop. Okay, so bone conduction on the left ear was 9 seconds and 20 for air conduction. And we'll try this ear. Stop. Okay, so that was 8 seconds bone conduction and 21 for air conduction. And then I'm going to, we're going to check all of your lymph nodes here. We've got the pre-auricular lymph nodes, got the post-auricular lymph nodes, occipital lymph nodes, the retropharyngeal lymph nodes, we've got submental, sublingual, submandible, or submental, facial and parietal lymph nodes. There's the supraclavicular lymph nodes. Can you kind of shrug your shoulders like this a little bit? These are the supraclavicular. Oh, the superficial lymph nodes. I'm unable to palpate any of the lymph nodes, which is normal findings indicating absence of any infection or inflammation of those lymph nodes. Let's see. I'm going to do a whisper test. I'm going to have you plug one of your ears, and then I'm going to whisper 3 words, and then just let me know what I'm saying, okay? Car, truck, boat.
Car, drug, boat.
Car, truck, boat.
Cart, truck, boat.
Yeah. And then we'll do the other ear. High chair, plane, fish.
High chair, plane, fish.
Okay, perfect. So we did the Weber, the Rennie, and the whisper test for the ears. I'm going to have you look this way, and I'm just going to check your spinous process, which is midline and symmetrical. I'm just going to feel, can you sit close? There we go. I'm just going to feel for any bumps or bulges. Can you take a deep breath in for me? Perfect. And then out, and then another one in. Perfect. Her thoracic expansion is equal bilaterally. Everything appears symmetrical. I'm just going to percuss the anterior chest. Any pain or tenderness? Okay. I'm going to check down here for CVA, the costal vertebral angle. Any pain or tenderness there in that area? Okay, that's indicating an absence of any pain or inflammation around the kidneys. I'm just going to listen. Go ahead and take some deep breaths in and out. Okay, perfect. Lung sounds appear clear bilaterally. I am going to have you say the words 99. I'm checking for tactile fremitus.
99.
Again,
99.
again,
99.
and again.
99.
Perfect. Okay. Now looking towards me, can you do the same? Say 99.
99.
Perfect. I'm going to just inspect the skin. All of her skin so far has been intact. Her the temperature, it's warm and dry. There's no lacerations, no bulges or bruising noted. Her chest is symmetrical. It rises and falls with each breath appropriately. We'll percuss. Okay, and then I'm going to listen. Go ahead and breathe for me. Oops, sorry. Can I go under this? Okay, perfect. And then I'm going to, long sounds are clear throughout all of the lobes bilaterally. I'm going to feel for the PMI. Perfect. And then I'm going to listen to the apical pulse for 30 seconds. Can you take this off? Is it just, do you have a sports bra underneath? Perfect. Thank you. So I'm just going to listen to the apical pulse. Okay, it's 40, so that's 80 beats per minute. She's got a normal rate and rhythm. I'm going to listen to the 5 heart sounds with the diaphragm. We'll start with the aortic. The pulmonary. The erbs point. Tricuspid, and the mitral valve. And then I'm going to listen with my bell and the 5, aortic, pulmonary, erbs point, tricuspid, and mitral valve. She's got normal rate and rhythm for S1 beats. There were no S3 or S4 beats noted. Everything was regular and no murmurs were present. I'm going to just do some range of motion on your shoulders. Can you pull your arms up? Perfect. Can you shrug your shoulders? Can you put your chin to each side? Chin to the chest. Head all the way up. And then put your head side to side. Perfect. I'm going to have you push against the resistance of my hand. Okay, and then the other. Like try to put your chin, there we go. And now, okay, go ahead. And then go forward. Perfect. And then backwards. Perfect. Can you go forward again for me? Okay, let me do it again. Go back. And then forward. Okay, perfect. I'm checking the trapezius and sternocleidomastoid mastoid muscle tone, which is strong. I'm going to check your brachial pulses. Brachial pulses are strong bilaterally. I'm going to check radial pulses. Perfect. And then I'm just going to, if you could put your leg down here, I'm just going to feel behind your knees for the popliteal pulse. And then on this one. And then the tibial pulse. And her pedal pulses. I can't see them in the video, but okay, all pulses were strong bilaterally. Let's check your reflexes. I'm going to do your bicep, tricep, and then brachioradialis. Let's go ahead and just relax your arm. There we go. There we go. And you feel that? And here. Perfect. And we'll do this one, bicep, tricep, and brachioradialis. All right. All right. Go ahead and just put it loose. There we go. Perfect. And then I'm going to check your patellar reflexes. Okay. And then down by the Achilles, checking your ankle. Perfect. Now with your arms, I just want to check your range of motion and your strength in your arms. So can you do this for me? And then this. And then rotate your wrists with your arms like that. Push up against my hands and then down. Perfect. And then with your hands, let's do a push. And then pull them, put them like that, pull them up. Perfect. And then open your fingers, close your fingers. Now open up against me. There we go. And now can you touch your thumb to each finger? Now do it fast, rapidly. Perfect. Good deal. Next, I'm going to check your abdomen. So can I have you come over here and lay down? I don't know if you want to do it this way or that way, but perfect. So first I'm going to just inspect the abdomen. Her skin is slightly whiter on her abdomen due to lack of skin exposure in that area. Otherwise, everything appears symmetrical in midline. Her umbilicus is midline, there's no bulging. I'm going to listen to the aortic area for any bruits, and then I'll listen to all 4 quadrants for bowel sounds before I percuss. Okay, no bruits present. And patient has active bowel sounds in all 4 quadrants. I'm just going to percuss the abdomen. Perfect. Now I'm going to just test your abdomen, feeling for any pain or tenderness, seeing if there's any enlarged organs. Do you feel any pain or tenderness? Okay, so I'm going to go a little bit deeper. Any pain or tenderness there? Okay. Perfect. I'm going to feel for the patient's femoral pulse. Sorry. Femoral pulse is strong bilaterally. And then I'm just going to palpate here for the inguinal lymph nodes. And they are unable to be palpated, indicating absence of any infection or inflammation. I'm going to instruct the patient on doing breast exams and checking underneath here for the axilla, looking for any swollen lymph nodes. You want to lift your other arm up for me? It's important to do self-breast exams once a month, preferably the same time each month, while you're in the shower, when everything is warm and loose. You want to raise your arm and then using the tips of your fingers in circular motions, you'll be feeling around the breast tissues, looking for any bumps or tenderness, any lumps, anything like that. You would notify your physician. If this was a male patient, I would be instructing him to do the same with his testicles, the same time every month, while either in the shower, right after the shower, rolling them between his fingertips, looking for any abnormalities. I'm just going to check the range of motion in your hips. So can you take your right leg, take your knee to your chest? Perfect. And then can you go straight up with it? And then can you pull it up and then outwards? Well, yeah, okay, sure. And then go ahead, put it down, and then, careful when you do that. Let's do your left leg, up, and then straight up. Okay, and then can you bring it out? So she's got flexion and extension, adduction and abduction. Now you can go ahead and sit up for me. If you want, you can, I think you can get back in the chair now. I'm just gonna feel the legs, and her muscle tone is good bilaterally. Can you lift up, try to lift up your knees one at a time? Okay, other one. And then pull your legs in. Okay, now try to go against mine, go out. Perfect. Now can you point your toes upward and then down? Can you turn your ankles outward, inward, and then rotate your ankles? Okay. Push against my hands, pull up against my hands. So she's got good muscle tone in her legs. Again, there's no bumps, bruises, or lacerations. Skin color, temperature, and turgor is all normal. I'm just going to check sensations here. If you can do me a favor and close your eyes and let me know what you feel and where you feel it, okay? I need to know the location and then what you feel, like what type of a touch, whether it's soft or hard.
Light touch on my right arm with cotton.
Okay.
Left arm, cotton.
So soft.
Light. Yeah.
Yep, okay.
Vibration on my right wrist.
Okay.
Vibration on my left wrist.
Okay.
Like a sharp
Okay. Over here.
point.
Okay.
Sharp point on my right leg. Sharp on my left. Vibrating on my left. Vibrating on my right knee. Soft on my knee. Soft on my knee.
Perfect. So the patient is able to distinguish sensation on her upper and lower extremities between vibration, soft and sharp objects. Now keep your eyes closed for me, and I'm going to put something in your hand, and I want you to tell me what that is.
A penny.
Yes. Keep your eyes closed. I'm going to put something else in your hand, if you can let me know what that is.
A rubber band.
Perfect. Now I'm going to draw something on the inside of your left hand, and let me know what it is.
A V.
And then
A Y.
Yep.
3.
yes, perfect. Okay, now I'm going to have you stand up for me. And then I want you to look this way. And then bend over and touch your toes for me. I'm just checking the range of motion in her spine. She's able to touch her toes. There's no scoliosis, kyphosis, or lordosis present. The spine is perfect and in line. Go ahead and stand up. And then can you turn side to side? Like just, there we go. Go backwards. She's able, and then forward, flexion and extension, everything is intact. I want you to put your feet all the way together and then close your eyes. Perfect, so the Romberg test is negative, patient is not swaying. Are you dizzy at all?
Mm-mm.
Okay, perfect, so there's no dizziness or swaying noted. I'm gonna have you, one thing I forgot, I apologize, sit down for me. When I was doing the range of motion, I should have you take your right heel and run it up your left shin. Okay, and do that on the other one. Perfect. Now I'm just going to have you stand up and then walk across the floor for me. Go ahead and walk. Just take normal steps. Perfect. And then when you walk back, can you walk heel to toe? Perfect. All right, I believe this concludes our head-to-toe exam. The patient had a steady gait. There's no abnormalities noted. Do you have any questions? Okay, I think that was it.